I have two children with SMA, one Jackson, one Weston. Jackson was originally diagnosed with SMA in 2017 at 5 months old. We stayed in the hospital until the new year, and in February he passed away due to no treatment to SMA at that time. Four years later, Weston comes along, and little did I know at the time he was going to be SMA type 1 as well. I knew that he was going to have SMA. It was just an initial gut feeling, mom instinct, I guess, and later confirmed with amnio, and then of course later confirmed with newborn screening, thankfully. That proceeded to me jumping the gun and going ahead and getting the ball rolling with gene therapy and getting all that going. When Weston received the treatment, like I said, it was a weight lifted off my shoulders as soon as that button started. A healthy 11-day-old baby getting this awesome treatment and just waiting for the outcome of what would happen. With Weston, the way he is reaching all of his milestones is absolutely amazing. He's walking, talking, eating, running, playing baseball. So he's doing phenomenal, and those things are absolutely a miracle. It's unreal to see an SMA child running, walking, talking, doing normal kid activities, and it's also heartbreaking just because of the last experience. I'm just happy to see him being able to thrive like a normal 2-year-old, be able to play with his friends at daycare or his cousins, and he shouldn't be. Potentially, medically, he should not even be here just because of a diagnosis. Knowing how new gene therapy is, and it's a once-in-a-lifetime treatment, it's absolutely amazing. We're so thankful that we were able to receive it. Okay, blow him a kiss. Tell him bye. Bye.
So wonderfully inspiring story. I'm going to come back in a few minutes to the Cook family. Good morning. My name is Mark Battaglini. I'm responsible for global strategy for the Alliance for Regenerative Medicine. When I was told I was going to have to do the final comment statement at Mesa, I asked my comms team, what topics do you want me to cover, and they said, don't worry about it. Nobody shows up for the final statement, so you have nothing to worry about. And I responded by saying, well, so I'm basically be talking to a dark room. And they said, I said, what are we looking at? They said, the over/under is probably 20. So we surpassed that. I'm very grateful for your attendance this morning. I've been at ARM for 10 years, and one of my assignments has been to participate in a number of panels, usually with payers and other government officials and the media relating to regenerative medicine. And I tend to start my presentation with the statement from the article in The Economist last year, comparing the science behind cell and gene therapy to the global eradication of smallpox back in the 50s and 60s. And then I would sit down and the other panelists would come up and talk, and they would begin and talk about our technology as experimental and futuristic and niched and unproven. After going through this for a few months, it became clear to me that if we're going to be the voice of the sector, there were certain things the Alliance needed to do more of and needed to do better. First, We need to continue to assess, generate, and communicate data that will frame this technology as sustainable and permanent. I hope you were here yesterday to hear Mark Trichan's data release as it relates to the durability and the ability of our clinical trials, and the fact that it's better than sometimes 3 to 2.5 times better than other technologies and other platforms. It was picked up, I think, actually before his presentation, was picked up in Fierce Bio. Stephen Majors, I think, just told me STAT also picked it up this morning. And one of the things Mark shared with me when I was interviewing him at the ARM Studios is that this just can't be it. We have to be generating more data to prove a solid case that this sector is sustainable. It is also incumbent upon us at ARM to be smart about our approach to data. One of the things, and this is just one example of what we're doing internally to show that gene and cell therapies are not relegated to limited markets, is that we looked at kind of where the patient population is for treatment right now with the pending approval of sickle cell disease and the rare diseases that we're involved in right now, as well as some cancers. And we're talking, obviously, at this point, tens of thousands of patients that we're treating. But soon, we're going to be looking at millions of patients who are suffering from wet AMD, diabetic retinopathy, and other more prevalent diseases and conditions that will be treated eventually by gene therapy. And the simple conclusion is that the technology is becoming more mainstream. When we revised our mission in January at ARM, we wanted to make it clear that our patients are our true north. And we wanted the patient stories to be at the forefront at Mesa. We felt it was critically important that the audience hear the trials and triumphs of Weston Clark, which you just heard, Jimmy Olgaleri, which we heard on Tuesday. And you know, in my previous life, I had the great fortune to work on therapies that will cure and at least dramatically transform the life of children that essentially have been handed genetic death sentence. And I made it a point when I was at my previous company to get to know the families who lost their children to the diseases that we were investigating. This article was in the front page of the Boston Globe back in April. And it talks about 2 families. One family whose son was diagnosed with cerebral adrenoleukodystrophy and was fortunate to be treated by a brand new gene therapy that just came out earlier this year. And it also told the tale of a family whose son was diagnosed roughly 8 years ago and unfortunately did not have the ability for treatment at that time. And it goes on to tell the story of how Lisa Seeger, who was the mother of that child, turned her grief into a crusade, a national crusade. And this is very personal to not only to me, but a lot of the other former Bluebirds that are in this audience right now, because we were very much involved in working with not only Lisa, but other parents who lost their sons to CALD. And you have to appreciate the courage and the fortitude and the commitment by some of these families who, in some cases, just a month or 2 earlier, lost their son and then were with us on Capitol Hill or the state capitals trying to advance the cause of newborn screening. That's one example of the impact that patients and caregivers can have in the area of policy. I've been involved in advocacy for some time. Contrary to this slide, which I showed my staff, I was not around in the inception of Easter Seals, but probably at least a good 2 dozen years And I cannot think of an instance when significant health policy has been achieved without patient engagement and advocacy. Our member organizations have done an extraordinary job engaging and partnering with the patient community. But if ARM is going to be the voice of the sector, we need to walk the walk and place resources into alliance building grounded on listening, understanding what is important to these diverse groups, and to achieve mutually agreed upon priorities. Not the least of which is access, especially for the more vulnerable populations in our society. You heard several times during this week that our current healthcare system presents challenges for one-time administered, durable, and potentially curative treatments, which require high upfront investments. It was realized several years ago that something needed to be done relating to the budgetary pressures, the upfront cost of these therapies. And we needed to explore new, innovative payment mechanisms. And we needed to have a dialogue with the federal government, not a one-way conversation on a workable access model. To understand how CMS is approaching this work, I have the pleasure of introducing Ellen Lukens, Deputy Director of the Center for Medicare and Medicaid Innovation, and the former head of its Policy and Programs Group. Ellen is also a former consultant in the life sciences sector. And to lead the conversation, somebody who I've known for over 20 years in health policy, Mark Samuels, President and CEO of ADV Health, a strategic consulting partnership in healthcare and life sciences sector, including at ARM. Please give a warm welcome to both Mark and Ellen.